Hello friends, in this video we will discuss about the glucose transporters. Friends, glucose is a molecule which is hydrophobic, which cannot pass through the lipid rich membranes of our cells. So this nature or this body develop or create the channels or transporters which we call as the glucose transporters, which help in the transport of these glucose molecules into the cells from the extracellular fluids. Okay, so these are the two types of the glucose transporters. One is sodium dependent glucose transporters, which we call it as a SGLT, and second is glucose independent glucose transporters, which we call it as a GLUT. Okay, these are of two types, SGLT1 and SGLT2. SGLT1 is basically present in the small intestine and also in the proximal renal tubules, which function is to absorb glucose. Okay, and its clinical application is in the ORS, oral rehydration solutions, in which by this based on this mechanism ORS is made and made. SLT2 is present in the proximal renal tubule and its also function is to absorb glucose. Okay, and we all know the oral hypoglycemic drugs, which we called it as SGLT2 inhibitors like gliflozins, which act by inhibiting this SGLT2, which inhibit the these channels and the prevent from reabsorbing that glucose into the in a proximal convoluted tubule and promote the excretion of this glucose. Okay, so the characteristics of the SGLT1. SGLT1 is a sodium dependent, it is unidirectional. This is secondary active transporters, and it's a simport transport glucose along with the sodium. Okay, so why we call it as a secondary active transporters? Because this channel or transporter not use ATP directly. It is work on the it is work along with the concentration gradient, but that concentration gradient is created by the second channel which uses ATP. Okay, so let's see, this is the cell of the intestine, this is a lumen of the intestine, and this is the basolateral area. Okay, or the or blood vessel. Okay, this is the cell and this is the lumen. So here are on the luminal side there are the sodium and the glucose channel, this is SGLT1, and this is the sodium potassium ATPase. This sodium potassium ATPase put three sodium out of the cell and gets 2 potassium inside the cell. So this create here is the less sodium concentration. Okay, so create that oxidation concentration gradient for this luminal sodium to come inside. Okay, so and along with that sodium glucose come inside the cells against the concentration gradient because of this sodium. Okay, now we see the second type of the glucose transporters, that is GLUT2. GLUT are the sodium independent glucose transporters. First is GLUT1. GLUT1 is very special because it has very high affinity and the low Km. Means that when there is a very low concentration of the glucose, then also these channels or these transporters can transport the glucose into the cell. Okay, because they have the very high affinity for the glucose. Okay, so they are present in the brain, placenta, kidney, RBC, colon, and the retina. Okay, they work when there is a very depleted storage of the glucose. GLUT2 is present in the beta cells of pancreas, sinusoidal cells of the liver, basolateral side of the intestine, basolateral side of the proximal renal tubules. Okay, so they are very low affinity and the high Km channels. They work when there is a low, when there is very high concentration of the glucose. So according to that their function is also set. Like they help in the insulin secretion. They are present in the basal cell of pancreas. When there is very high concentration of the glucose in our plasma, they stimulate our basal cells to secrete the insulin. Okay, to lower that glucose concentrations. They help in the uptake of the glucose for the storage in the liver by acting on the sinusoidal cells of the liver uh, for the formation of the glycogen to store it. Okay, it also help in the absorption of the glucose from the intestine and the renal. Then there is a GLUT3 which is not present in this chart. Sorry, GLUT3 is also present in the brain, retina, kidney. Okay, so they are also the low affinity and the high Km channels. I previously explained that low affinity means high affinity means they can function when there is a very low concentration of the glucose, so it helps in to function the brain when there is very depleted storage of the glucose in our body. Okay, then there is a glut 4 which is insulin dependent or the insulin sensitive channels which are present in the heart, adipose tissue and the skeletal muscles. Okay, so they help in the decrease blood glucose. Okay, so their maximum extraction of the glucose is occur in the postprandial state. The next is GLUT5, which is present on the luminal side of the small intestine and the spermatozoa, which specifically transport the fructose inside the cell. Then sixth is GLUT6, which present in the spleen and the leukocyte, which are the pseudogenes. There no function in the transport of the glucose. GLUT7, which is present in the liver, smooth endoplasmic reticulum. They transport the glucose across the smooth endoplasmic reticulum. Okay, so these are the 7 types of the GLUT. So friends, this is all about the glucose transport and the glucose channels. Okay, so I try to explain to you, but if anything I mistaken or there is anything to improve, please let me know in the comment section.